Nous sommes heureux de vous présenter la session « Combler les lacunes en matière de santé des femmes. Il est temps d'agir ». We're pleased to present you the session « Closing the Women's Health Gap. It's time to take action ».
Bonjour à toutes et à tous et bienvenue à notre session. Aujourd'hui, avant qu'on commence, nous tenons d'abord à souligner que les terres sur lesquelles nous sommes rassemblés font partie du territoire traditionnel non cédé des Kanien'kehá:ka, qui a longtemps servi de lieu de rassemblement et d'échange entre les nations. Bienvenue. On a un panel distingué avec nous aujourd'hui qui vient du Québec et aussi de l'Ouest du Canada et à l'international. Pour cette raison, la plupart de notre discussion aujourd'hui, ce sera en anglais, mais n'hésitez pas à utiliser les services de traduction au besoin. Good morning, everyone. My name is Mike Cassia. I am the Managing Director of Organon Canada, and I have the pleasure of hosting today's discussion on closing the women's healthcare gap. For those of you who do not know our company, you are forgiven. We are fairly new. We launched in June 2021 with our headquarters in Canada here in the Greater Montreal area and our global headquarters in the United States. That said, we are active in over 140 different countries. And when we launched, we became the only company of our size with a primary focus on women's health. As part of our mission, we believe that we can help to close the women's healthcare gap. But in addition to that, by partnering with governments and with organizations like the ones represented on the stage today, we can do more than that. We can achieve better gender equity through healthcare, because health permeates every aspect of life. This is a fact that became all too true to myself and my wife during the pandemic. While we were standing up Organon as a women's health company, her and I lost a very close friend of ours in her early 40s to breast cancer after a decade-long fight. She was diagnosed in her late 20s, and we remarked that when that happened, it changed her perspective on career, on relationships, on her vision of life and her ambition. Because healthcare touches every aspect of life. And when there are inequities, it touches career, it touches the economy, and it invades the fabric of our society. And as we grew Organon, we began to see some of these details around the gap emerge a little bit more clearly to our team. 80% of healthcare dollars in North America are influenced by women, yet only 4% of research and development go into women-specific disease areas. If you cut out oncology, that drops to 2%. In 2022, the pharmaceutical pipeline was made up only of 2% of research and development assets. In addition to that, these lack of research and investment has an impact. When we think about the #1 killer of women in our country, which is cardiovascular disease and stroke, only two-thirds of the research historically in that area have been done on men. And the Heart and Stroke Foundation of Canada has said that nearly half of women suffering from a heart attack do not have their symptoms recognized. We may believe that issues such as unplanned pregnancies are no longer as big an issue as they once were and compared to other nations. But here in Canada, nearly half of pregnancies are unplanned. And I'm happy to see that certain governments like British Columbia and the federal government are beginning to take action through the initiatives of individuals on the stage. In addition to that, when we look at women entering the age of menopause, by 2030, 1.2 billion women globally will be entering the different phases of menopause. Nearly a vast majority of them will say that the symptoms affect their daily lives, but only a quarter will be able to seek treatment. If we look at the cost associated with just hot flashes alone, it's $1,400 per person for healthcare costs and $770 per person in worker loss of productivity, times 1.2 billion. So when we look at the statistics from the World Economic Forum, who has said that if we are able to close the women's healthcare gap, we can increase worker participation and in turn increase GDP by an average of 1.7% per capita. These are all things that and there's so many things to discuss around women's health and the gaps that exist. And I'm very pleased and honored to have a distinguished panel with us today to address some of them and discuss how we can all help close the gap. So with that, I'd like to introduce our panel. To my left is Madame Caroline Codzi. She is founder and Chief Equity Officer of Women in Governance, which supports women in their career advancement and organizations looking to close the healthcare gap. She is a true change agent, and she dedicates her life to all matters relating to the access of women to executive roles and board positions here in Canada and outside, as well as women's equality. We have also on the stage today Dr. Susie Fiedler. She is Organon's Chief Commercial Officer and responsible for the company's global business strategy. She aims to drive growth for our company, but also ensure that we listen to and learn from women. In fact, she brings an expertise in looking at what other countries are doing internationally to help close the gap. We also have Dr. Diane Francoeur. She is Chief Executive Officer of the Society of Obstetricians and Gynecologists of Canada, a highly decorated OBGYN. She continues to serve her community as a practicing OBGYN today and is a fierce advocate for women and for healthcare providers. And then finally, Madame Charlene Rutherford. She is the Alberta Women's Health Foundation's President and CEO. The Alberta Women's Health Foundation supports the advancement of care and research in women's health by harnessing partnerships, collaborations to break down borders, and expanding fundraising reach across Alberta and the nation. So I welcome you all to the stage tonight. Thank you for joining us. The first question I have goes to you, Dr. Francoeur. We talked about some of the gaps in terms of investment and how they feel through into the healthcare gaps, but also impacts on society. Can you share your thoughts on why you believe there still exists a persistent underfunding in the area, and what can be done differently?
Well, first of all, I think that in order to be able to serve women better, we need to talk about money. We need to see women as an asset, not an expense all the time, because we used to care about women with empathy, but we don't look at what they really need because we don't have any dashboard on women's health in this country, so we don't know. We just gather a few information like waiting time for surgery. So I live in Montreal, I practice in Montreal, but I work in Ottawa where our offices are, so I'm exposed to the two most dysfunctional provinces in our country. And unfortunately, in Ontario, the waiting time for a non-cancerous surgery for women that we call benign is 3 years. Do you know any man who would wait for 3 years if he was peeing in his pants? I don't know anyone in a position of power who would tolerate that. So we really have to speak out. In Quebec, here, we know that there are 78,000 of consultation waiting to be seen. So when you know that disease like endometriosis sometimes takes 8 years before it gets diagnosed. So if you add on that the number of years you're going to be waiting plus the number of years you're going to be waiting for surgery, it takes forever before you were able to take care of women. And now we know that women are going to be filling most of the job, especially women between 45 and 55, so we need to care about them, because if you've been waiting for 3 years before you get your surgery, you're not going to be able to go back to work. And you're most likely, if you have endometriosis and pain, when there's lots of medication who can cure this disease, well, you can get into the trap of the opioid use. And so this is why we really need a dashboard to know how healthy are women or unhealthy they are not, and what industry and workplace does for them.
Thank you, Dr. Francoeur. You mentioned a few areas of underfunding and some in terms of gaps of diagnosis with endometriosis. I'm going to go to you next, Charlene, in terms of a question. Sorry. So building on some of the points that Dr. Francoeur mentioned, from a research perspective, what are some of the key highlights that the Alberta Women's Health Foundation has brought to light regarding the gaps of underfunding in women's health?
Thank you, Michael. I want to start by saying what a treat it is to be here in La Belle Province and representing the Alberta Women's Health Foundation at this important conference, and to be part of this panel with these amazing women who are so well regarded and well known in the field of women's health. So, merci beaucoup de m'avoir inclus. Je suis reconnaissante. Thank you so much, Michael. Yes, we at the Alberta Women's Health Foundation, we fund the Women and Children's Health Research Institute, and we hold a number of research chairs that work across the province. And we were fortunate to work very closely with our Women's Health Research Institute, and we led a paper which started out as a survey, a public survey across the province of Alberta, a web-based survey, in which we had over 2,200 women respond. And it was really the core and the heart of that paper was really the understanding of what would happen if we ensured that, or if women's health topics remained taboo and difficult to talk about. And that's really an important thing to think about, because when you think about what is something that is taboo, it means that it remains in the dark, it means it's hidden in the shadows, and therefore it remains complex. And with women's health, it's already very complex. So the inability for many women to even continue to talk about their health is sometimes hampered. And we know that there's a lack of awareness of what is normal. We know that there's inaction that's linked to worse outcomes. There's a normalizing of conditions when they shouldn't be normalized. And there's a domino effect on the mental health and physical health of women as a result of these things. So as I said, we had 2,200 women responded to this survey, and I think they saw it as an opportunity to really unload. And they shared with us their comments, and we found out through this survey that on average, women suffered from not 2, not 3, not 4, but 5 pelvic floor issues of some kind. And so in our report, we were able to rank these we had 12 conditions that we identified, and we ranked them. The highest percentage, of course, was, no surprise, perhaps, painful periods at 68%. The lowest was ovarian or polycystic ovary syndrome at 9%. And there was everything in between: fibroids, endometriosis, chronic yeast infections, urinary incontinence. The list really went on. And women expressed how difficult it was to find a care provider. Only 24% thought their care provider really understood gynecological health. And really only 2/3 really had confidence in what their health care provider knew. So there is a challenge. We recognize that there's a deep challenge in Alberta, but what we also understood is women in Alberta are not unique. Women in Alberta are like women across Canada, and probably these same conditions, these same outcomes, these same percentages impacted others the same way. But the most compelling comments that we received in that report, and again, I have to say a big thank you to Organon, as a sponsor of that report. You really helped us get this information out to the masses once we had that report complete, and we were so grateful for that. One of the most compelling comments came in the area of menopause and perimenopause. The respondents who shared that menopause was a challenge indicated 75% of them said it impacted their work life. It impacted their ability to contribute from their skills and their abilities. It impacted their ability to lead people. It impacted their ability to contribute to culture. And 10% indicated that they would probably leave the workforce. That is so significant. And I know we're going to talk about that further. Caroline is going to talk about that a lot more, and we talk about the economic cost, and thank you, Michael, for talking about that. It's important, but there's also a human cost. And I hope it's okay to share this, but I know, and I'm sure there are people in this audience today, but I know of 3 women who died by suicide because they could no longer cope with the challenges of menopause. the very life-altering challenges that made living so difficult. That's a very human cost. So talking about the economics of this is one thing, and it is so hugely important. But these are lives lost that leave families behind, partners, colleagues, friends, all of whom cherished a life that it became so difficult. So that we have a moral imperative to find answers, to move research forward, and to ensure that women's lives improve. And very important. Thank you.
Thank you, Madame Rudder, for sharing that story. I mean, the impact in terms of people is clear when we look at healthcare, and the undertreatment of symptoms related to menopause is something that I know this group has talked about in the past. Moving on also to other areas where women can be impacted. Madame Kodzi, you're a leading advocate for women in leadership roles. Can you elaborate on the impact these gaps can have on the corporate world and maybe translate that into the workplace?
Of course, mais d'abord bonjour à tout le monde, c'est une joie pour moi d'être ici et vraiment un honneur d'être sur scène avec ces personnes extraordinaires. Merci aussi à Organon pour tout le travail que vous faites depuis longtemps sur ce sujet très important qui est la santé des femmes. And if we want to talk about women's careers, if we want to talk about their advancement in corporate Canada, we have to take into consideration their health and their very unique needs. And you have referred to a report that was released at Davos, and I read that report and I was shocked to learn that for about 700 common pathologies, women would receive a late diagnosis. Alors, il y a beaucoup d'injustices sur ces questions-là. And how can we expect women to be able to advance in the workplace, to be able to have a fair chance to raise from the sticky floors, to go through the glass ceiling, if they have to go through the hoops just to get their health in check? You also spoke about adding to GPD, to global GPD. If we want to talk about the economic impact, it's $130 billion that is added to our global GPD. So if you want GDP, if you want to actually to make $3 on the dollar invested, you invest in healthcare, women's healthcare. That's the return on investment. And it's quite simple to understand. I mean, if you look at a woman's career, it's like we're either too young, too old, about to have a child, we're in menopause, we've got our periods. They're always finding excuses for putting barriers. And there is a reality, there are things that we are going through, but there are ways to alleviate these problems, and there are ways that the workplace can also offer a certain level of flexibility, understanding, insurance coverage, etc., to make it easier. And because we understand how important it is to have diversity in our organizations, because we know that women and men working together is the best recipe for innovation, for employee engagement, for penetrating new markets or creating new products or services. We understand that that's going to have a positive impact on the financial performance of any organization. And that is something that should speak to anybody who wants to make a difference. If you're not doing it to do the ethical thing, to do the fair thing towards women, at least do it. Also because if you look at our healthcare system, 70% of healthcare workers globally are women. We want them to be doing well. We want them to be healthy and to be in the workplace so that there's, Geneviève Biron is going to have quite a huge undertaking because our health system is broken. And so let's make sure at least that the people who are working in our hospitals, in our CLSCs, etc., are able to do their work because they're well supported. Also in our homes, we are the primary caregivers. We take care of our own children, we take care of our own parents, we take care of our spouses' parents as well. So we definitely have a lot more of a burden on our shoulders as is. And then they say, oh, well, women, it's all equitable in the workplace, they can make it. Yeah, but look at all the obstacles that we have. So I think it's an imperative to make sure that there is enough funding, because that is, at the end of the day, the key word. It's the money that is missing to make sure that all the research that's being done is equitably shared, so that the women are able to get the personalized support that they need. So the work that we do at Women in Governance is supporting progressive organizations such as Organon, for instance, find ways to meaningfully close the gender gap in the workplace by modifying their policies, implementing certain initiatives. But obviously, it's a multi-tiered approach, and thank you again for all the work that you do, Michael, and the organization in Organon.
Thank you.
Voilà.
Merci. I'll move over to Dr. Fiedler. Madame Godzi mentioned the impact it has in the workplace and how companies should be looking at their own policies to help include greater amount of women in leadership. When we think of you as a global C-suite member, can you share your thoughts on how international public health policies can have an impact in changing the status quo?
Yeah, thank you very much. I think we are at an inflection point. On the one hand, we realize more and more the significant unmet health needs that exist for women. And on the other hand, we also understand more and more the socio-economic costs associated to that. And as a consequence, we see more and more governments and other organizations taking action. If we think about countries and what they experience, usually it's very common challenges. They are confronted with falling birth rates and very high rates sometimes of unintended pregnancies, teenage pregnancies, particularly in vulnerable populations. And so governments around the world are realizing more and more the impact all of that has on their society and their economy. And these challenges, these demographic challenges I just mentioned, are particularly happening in the 21 borders that border the Pacific Ocean. So these are the APEC economies, and 17 of those face significant shifting demographic trends, and all of that has a long-term economic consequence. So for example, if you think about APEC countries, including Japan, China, and Korea, they are expected to see their population drop by 50% before the end of the century. But the good news is there are some multi-sector partnerships that have come up with new solutions, and one initiative I just wanted to share with you is the APEC Smart Family Initiative. Here, the public and the private sector has come together for these APEC economies to develop comprehensive policies focused on reproductive health and to be adopted by those 21 APEC economies. And Organon was part of this as a leading private sector partner. These policies can increase access to fertility planning and contraceptives, and they do that really in the context of advanced gender equity and an inclusion of women more in the workforce, because it contributes to global GDP tremendously. I think what's great about this Smart Family Initiative is that it brings really together different goals, the goals of the government, the goals of the private sector, and most importantly, I think the goals of women, their families, and all over society.
Thank you, Dr. Fiedler. I'll move on over to Madame Rutherford. Susie's talked about a little bit of the policies that have shifted in different parts of the world. I know your organization has also done tremendous work in terms of research, but also to help drive adoption of different policies in the Alberta setting. What are some of the partnerships and policy changes specific to Alberta, or maybe more broadly across the country, that you've seen in recent years? What does good look like?
So one of the tremendous outcomes of that paper was the way in which it shifted the conversation across the province of Alberta, and certainly we saw that within the health system itself. We have advisory councils throughout the province of Alberta, and the paper became central to the conversations about policy there. We also, and access, particularly about the concerns about access to healthcare delivery for women and health outcomes. Moreover, we had, the paper was central to the conversations by both a roundtable women's health planning by the provincial government, but also by the opposition. So it was interesting how it influenced both sides of the aisle. in their conversations. You know, moreover, I would say just recently the Alberta government is investing an additional $20 million in women's health research, both in Calgary and Edmonton, and the paper has directly influenced that. So there's been a true benefit of first reaching out, and I think that's where it was so powerful, is the basis for this paper came from the voices of women themselves throughout the survey. It resonated right across Canada in terms of media reach. There was tens of thousands of downloads. There was media interviews right across the country. In one afternoon, I did a syndicated radio interview group that resulted in estimated 9 million people hearing more about this paper. So it's become, in many ways, a resource guide, and it continues to be downloaded today off of the website. So a very important aspect, and I think very influential. You know, over and above from that, I do think there is a change happening in Canada. I think we're at a watershed moment. I think we're at a point in time in history, and as what you've said, is that corporate Canada is also making bigger decisions now about its support for women's health and women's health research. And these are, you know, bigger players on Bay Street and beyond who recognize that these decisions speak to their clients, their customers, their employee groups, their shareholders, and certainly the executive suite, as more and more women attain positions in power and have those opportunities to shape those decisions themselves. So, you know, we recognize that 45% of women in Canada are over the age of 45. This is the cohort of women that's making decisions and bringing and ushering in that discussion, particularly about menopause and how things need to change. This is also the cohort of women that have the dollars to spend on their own health and want, you know, and are not afraid to spend it because they want to remain healthy, they want to stay in the workforce. And similar to what Carolyn is saying about how the impacts of women in the workforce, you know, it is such a challenge. One of the comments we heard in the report was, you know, you work so hard to climb the corporate ladder over the years, and it's difficult. You know how it's difficult for women. They climb that corporate ladder, they get into the corner office, and who moves in there with them? Menopause. So their job becomes a challenge, and it's not because of the job, it's because of the, you know, the physicality of the condition and what's happening. So it is impactful. But there are big changes happening, and we're proud to be part of it, and we're proud to be part of the movement that is ushering it in. Thank you, Michael.
Thank you. So, Madame Kodzi, Charlene mentioned a few items in terms of unique challenges that women face from a health perspective that men do not. How do you think employers should look at their own internal policies when it comes to women and their health to ensure that we have better representation at leadership?
Well, I think first of all, it's very important to stop and understand where you stand on the gender parity spectrum. A lot of organizations tend to just continue the way that they've always operated, and they tend to think that it's a fatality that they cannot attract or retain the women. So one of the key aspects of our work at Women in Governance is our parity certification. So organizations like Organon that want to understand where they stand, what do they have to do to get better, how to get there, etc., will go through this process. So first of all, it's to really do a sort of a self-audit of what is it that we do, what does it look like at every level of the organization, where are the women, where are we missing women, why are they not progressing, is there a broken rung somewhere, what are the causes, because you cannot close a gap if you've never measured it, if you don't understand its root causes or its magnitude. So first of all, you really need to sort of remove these dark glasses and start looking at it in a very pragmatic way, and what gets measured gets done. So once you put that down on paper, that this is where we stand. We are okay attracting the women, but then the turnover is such that they actually leave in much bigger numbers than the men. we are attracting the women, but they are stuck in the job that they started in. There's no promotions. And all of this you need to do on an annual basis. You need to remeasure. You need to benchmark yourself to the cohort, benchmark yourself to yourself last year, the year before, and see how you're progressing. And this is key. If you actually want to do something meaningful to modify, you need to understand where you stand, and then, with our help, get the recommendations that are necessary in terms of the policies that you want to modify, of the culture shift that you want to see in place, of the initiatives, the concrete initiatives that you can implement to actually facilitate all that. And things like, offering flexible work hours and offering days for menopause. We talked about that. When we finally reach that age where we're able to get that corner office or sit on that prestigious board, well, that's the age where, we're probably hitting menopause. And for certain women, it's easier than for others. But for certain women, it's difficult. It impacts your mental health. And actually, our mental health is impacted a lot of times during our life, a lot more than the men are. Hormonal changes when you get pregnant, when you have postpartum symptoms, when you have menopause. And so definitely these things need to be taken into account, but I guarantee you that it is so worthwhile taking the time to see what type of accommodation can be given to women so that they can feel welcome in the workplace, that they can fully contribute, and that they can actually really have an impact within the organization. So my only, I would say, word of caution about these things is the fact that we don't want stigma. We don't want unconscious bias to kick in. We don't want people thinking, oh boy, okay, now we have to give extra days off for women because of menopause, it's complicated. And recruiters, when they see a young woman coming for an interview, they're thinking, I cannot ask, do you already have children? Do you want more children? But I can guarantee you that this is going through their minds. And then when they see a woman that they're, how old is she? Is she over menopause? Do you think this is still going to come into play? So this is really problematic for women. And there are countries in the world, like Germany, for instance, that are looking at legislation to make sure that women are not discriminated against because of things like menopause. And that, things that any employer can do is make sure that they train all managers around these questions, and that the managers are sensitized and can behave accordingly when a woman seems to have had maybe heavy symptoms the night before, and that could impact, it actually, it goes as far as impact your abilities to a point where you can feel a bit of an imposter. We already have this imposter syndrome within us, but when we're going through all of this and we might feel overwhelmed, and it might impact our work, and we might be not giving the best of our output, it's also going to, it's a vicious circle. So there are things that employers can put in place, and it begins by understanding where you stand and having a clear pathway to where you want to go, and clear objectives, and put it down on paper. And this needs to go all the way to the board. You need to report on these things, and the board needs to hold the CEO accountable on things like this. And it cannot be a point in varia. It needs to be a very clear point on the agenda.
Thank you, Madame Codzi. So you bring some important points on the impact that these unique health challenges have, and how companies should be looking at policies so that we are not discriminating, we are educating managers to ensure proper representation. Recently, the last Nobel Prize winner had outlined one of the biggest contributors to the closing of the pay gap in the last 30 years, 40 years, which was access to contraception. So my next question comes to Dr. Francoeur. Can you provide your perspective on the importance of reducing the barrier to access for universal contraception?
Well, first of all, we'll celebrate when it's going to be done, because we don't believe in Santa Claus, so it needs to get done. So Caroline was saying that if you invest $1, you get 3 bags globally, but if you invest $1 in unintended pregnancy, you get 5 back. This is the BC model because BC has done free access to contraception before the rest of Canada, and this is the kind of number that they see. And the break-even is usually at 2.5 years, so if you want to make money, just invest on free access to contraception. So nevertheless, I think it was a good step towards women's health. So this is why we need to advocate, we need to talk about it and remove all the, the unconscious bias around it. But nevertheless, it's not done. Then we have to educate women. They have to know, because we're going to work with our partner on that, meaning nurses, nurse practitioners, pharmacists, to make sure that the access will really be there. Because, we talked a lot about problems, but there are solutions. And you guys from innovation, AI, and technology, you need to help us, because one of the biggest problems is the primary care access, but a lot of that could be done if AI would really stop in front of hospital for a while, because they just go through, and every time you don't need to talk to someone, this should be managed appropriately and get out of the physician desk, because this is, the bottleneck is there, and this is why people don't have access. So we're going to be doing some tools and work with women as well, so they know if they go and see a pharmacist, they are not going to be expecting to have a full lecture on contraception, because all the material will be there. We have to, unfortunately, fight against misinformation, because unfortunately with social media, women get what they think is best, but it's not always. So we have to make sure they're going to know where to go. But this is a reality, and I think it's a first step. And here in Quebec, especially when we had in the past very significant policy towards childcare, if you work in Ontario, you realize quickly that it is so expensive. The cost of daycare, it's a burden for women. So if we, remove all the ticks, contraception, because we spend 35 years paying for contraception. Usually women have that on their shoulder. So this one is on its way to go. Then we need to make sure that women will be able to stay in their position at work and address all the issue of the reproductive health period, which lasts about 40 years-ish, and that's where we need to invest and be present, but we need to talk about it and make sure that, the human resources will be accountable to manage, women's health good and be able to talk, because in the survey that you did and in the survey that the Canadian Menopause Foundation did, women are ashamed. They don't want to talk about it. So they rather like to quit their job instead of asking for help and question. And you know what? We have some really, really good medication to treat most of these symptoms, but women don't know about it because access is killing them.
So the education piece is extremely important, both in menopause and as well as contraceptions, misconceptions, things that I think a lot of organizations now are trying to do a better job at. I think also other countries are looking at different programs to improve the situation in both menopause and universal contraception. I'll pass this next one on to Dr. Fiedler. Can you provide some insights on women's health strategies in other countries, perhaps such as the impact in terms of universal contraception?
Yeah, absolutely. So I'm really optimistic for the future. Reason for that is that more and more countries, governments have started to take action. Also when it comes to free access to contraception, which is a real key enabler for women. France, for example, has implemented a national endometriosis strategy, and we heard about endometriosis is a really terrible disease, which is impacting 1 out of 10 women in reproductive age. And France really wants to become the leader in research and treatment of endometriosis. So I find this quite remarkable, on top of the fact that they also provide free contraception to all women under 25 years. Then we've heard about a listening exercise. England has done something similar to that, and identified the gaps in healthcare for women and the unmet needs women are facing in England. And so they have built on top of that a national women's health strategy where they really invest in healthcare services for women, on top of the fact that they have provided free access to contraception for the last 50 years, which I also find really remarkable. Just recently, the European Parliamentary Forum for Sexual and Reproductive Rights has published a global contraception policy atlas that really illustrates how different governments around the world are performing when it comes to access to contraceptives and family planning counseling. The atlas also gives indications of what can be done to improve policies, to really improve access to birth control. And it's really clear this tool helps us to see access to contraception as a central human right, and that it's urgently needed to improve the health of women. I think what we also need to keep in mind, and that will also be helpful, that we are at a turning point on a global political scale. This year, more than half of the world's population is in an election year. So I'm very confident that women's health will remain a key topic for government officials and policymakers, especially the area of contraception, which really affects so much of our population.
Thank you, Dr. Fiedler. So lots to discuss. I think that there's been a number of different discussion points today on how there is a gap that exists in different areas of women's health, how that impacts career, as well as the financial impact on the economy, and how organizations and companies need to be looking closer at how not only do they treat their employees, but how we invest in the future. We're coming up close to the time, so I wanted to give each of the panelists to give some of their final thoughts on the topic and anything else you'd like to raise for the audience today. Maybe we'll start at the end and move this way. So,
sure.
Madam Rutherford.
Yeah, thank you, Michael. You know, I think one of the things that is a challenge for women's health and health research in Canada is that women's health remains quite political. It's a political matter here, and it can be politicized. And that's to the detriment of progress. And it's going to take everyone across the public, private, and not-for-profit sector to overcome that and to put it front and center and just say, look, enough is enough. We need to move forward in ways that make a real, true difference to women. And I really believe it's going to be led, actually, by the private sector predominantly. And again, I would like to thank Organon for its leadership in this space, and certainly the policies that you've enabled and established in your own company, and how that allows others to follow. And it's going to be led by CEOs and the C-suite in these companies too, because when leadership talks about these issues, when your CEO and your CFO and your COO, and when they are openly talking about these issues, it gives permission to everyone else in the company to talk about these issues and to address them also. So again, I think we're making progress, but again, it's going to take everyone working together and first recognizing that we still have a heavy lift, and there's a lot of room at the table when it comes to women's health in terms of continuing to support it and to advance it. So.
Thank you. Dr. Faka?
Well, I think it's an ongoing process, and we have also to remember that things are not done and off the radar. Last year in Canada, there was an increase in cervical cancer. This is a very bad cancer for women because it takes part of bladder, intestine, radiotherapy, young women, usually in their early 40s. We have a vaccine to prevent it. What happened? Because the cost is a burden, so we have a very nice vaccination program in the whole country, but with the pandemic, it went away and it was off the radar. So I'm going back to my dashboard. So we need to know what's going on with the health of these women in Canada. Access to abortion, for now, it's fine in Canada, but we don't know what's going to be next, because usually when USA cough, we have a cold. So we have to be really, really sure that we're not going to lose our sexual and reproductive rights. So, having access to contraception, abortion services, menopause services, it's all, along the span of the reproductive life of a woman. So we really need to be there and watching the show. But but not to forget that the focus is that we want our women to be healthy, stay in their position, have the job that they train and learn to do because they do it well, and we're all in together. So it's not only a matter of the medical or healthcare provider profession. We need industry to partner. We need the government to focus on data. We need this data. We need this research to be done on women, because now 5 to 10% of the research at maximum in every country is on women's health. But when we look at the way women have impact of other disease. We talked about RNA this morning. Then you're going to see that 50% of women will be affected differently. So we're here for a long conversation.
Merci, Dr. Franca. Dr. Fiedler?
Yeah, I sometimes in these conversations when we talk about women's health, it almost sounds like we're talking about a niche problem, but we're talking about half of our population. And maybe we should advance the topic women's health more to talking about the health of women, half of our population. And I think what we've seen in other countries really is that if stakeholders come together and work together, drive change, that has an impact. For example, building together a women's health strategy. And I think as Organon, we really want to partner with organizations that are leading in that space and that they deeply care, just like the organizations that we've seen here up on stage. And I wish we could take the momentum we've seen today to really partner together to influence government officials and policymakers, innovators, investors, really to give women's health or the health of women the priority it really deserves, and where we all will benefit from. So a national women's health strategy for Canada, I think, would be awesome, and I also believe that the province of Quebec could take a leading role there.
Thank you, Dr. Fiedler. Madame Codzi.
Alors moi, je vais faire mon mot de conclusion en français. D'abord, ce qui est, je pense, incontournable, c'est que les femmes sont fortes, les femmes sont courageuses, les femmes sont résilientes, mais il y a un manque d'équité vraiment flagrant. Et Dr Franca mentionnait par exemple les recherches par rapport à, pas les recherches, mais les vaccins qui existent, etc. Qu'est-ce qui s'est passé, pourquoi on ne les a pas administrés. Moi, ce que j'ai lu également, c'est que les vaccins, les effets secondaires des vaccins Covid, il y a eu des recherches sur ces effets secondaires-là sans avoir une lentille de genre, c'est-à-dire que les effets secondaires sur les femmes sont très différents des effets secondaires sur les hommes, et on n'a pas mis assez d'emphase sur ce que les femmes vivent et subissent. Et il y a une espèce d'inéquité en général autour des femmes. Par exemple, beaucoup de recherches qui est faite sur des souris masculines, des mâles, plutôt que des femelles, et on sait que c'est plus simple une souris mâle qu'une souris femelle, mais encore une fois, les femmes ont certains problèmes, par exemple l'Alzheimer, qui touche plus les femmes que les hommes. On fait plus de recherches par rapport à l'Alzheimer du côté masculin, et ça, ce sont des choses qui me dépassent. On a vu aussi, par exemple, les crash test dummies pour les voitures, pour la robustesse des voitures. Le crash test dummy, il a la taille d'un homme, il n'a pas la taille d'une femme, donc l'impact lors d'un crash pour un homme, c'est pas le même que pour une femme, mais ça, on s'en soucie moins, alors qu'il ne faut pas oublier que les femmes, c'est 80% des décisions d'achat d'un foyer. La voiture, la Ford, peu importe la marque, il faut quand même qu'ils sachent que ce sont les femmes en général qui prennent cette décision-là, puis on ne s'assure pas qu'elle reste en vie s'il arrive un accident. Quand on a voulu envoyer un crew de femmes dans l'espace, on n'avait même pas la bonne taille d'équipement pour pouvoir les habiller, les femmes cosmonautes. Donc, il y a vraiment encore un problème à ce jour d'inéquité flagrant qui doit être adressé. Et je pense que ce sujet de la santé des femmes est un sujet qui doit prendre plus de place dans la conversation. Je pense qu'on doit vulgariser ces questions-là, qu'on doit en parler, que c'est accessible à tout le monde. Une fois qu'on a compris certaines notions de base, qu'on a pris le temps de se renseigner, de lire et de comprendre non seulement quelle est la situation, mais quel serait l'impact, combien la société irait mieux, combien notre économie serait plus résiliente si on s'assurait de mettre notre argent au bon endroit. Nous sommes 51% de la population, nous payons des impôts, nous sommes en droit d'exiger, d'avoir... Voilà, on va me demander si je vais aller me présenter en politique, la réponse est non, mais mais vous voyez ce que je veux dire. Moi, mon combat, il est pour que les femmes puissent atteindre les plus hautes sphères dans n'importe quel domaine. Et il nous faut notre santé, et il nous faut tous les outils pour pouvoir y parvenir. Voilà.
Merci, Madame Cody. Donc, avec ça, je vais terminer notre session aujourd'hui en remercier tous les panélistes. I'm going to thank the panelists for joining us today and engaging in this important discussion. I would also like to leave everyone in the room with a bit of our mantra at Organon, and I think it's been echoed by all the panelists today, and that is when she is healthy, she prospers, and that has an impact on her family and our society for years to come. So we look forward to partnering with the organizations on the stage and all of you to help close the gap. Thank you.